Okay, good evening, everybody. Welcome to the Scrutiny Committee for Children. Sorry?
Yes.
Yeah, we're live now. And I'd just like to welcome everyone who's arrived, and particularly the people online. You're probably wondering why I'm chairing it. I got a call this morning to say that Councillor Haley is ill. I think she is planning to join, which I think is very commendable. I'm not sure I would if I was ill, but she's going to join later. So I'm just standing in. So bear with me if I'm a little rusty doing this. Well, not rusty. I've got Cornelia here who will keep me honest throughout. So if we just have a look at the agenda today, we have two substantive items. One on send, which Aretha Banton will sort of lead off on, and I think several other officers will talk to. And then we're going to talk a little bit about the early help strategy. But perhaps if we just start with item one, apologies for absences. I have one apology from Robert. Obviously, Councillor Haley, I've already mentioned. Do we have any others? No? Okay. Item two, I believe there are no urgent matters arising, but does anybody want to contradict me on that? Matters to be considered in private. I understand again, there's nothing to be considered in private. Declarations of interest. Does anybody in any panel members present want to make any declarations of interest in relation to the agenda? No? No. Anybody online? Everyone's cool? Looks like it. We need to approve the minutes of the last meeting on the 2nd of October. Agreed? Anybody got any comments? Are we all agreed? Thank you. The panel's work programme. Obviously, we've reviewed this a couple of times. I was actually going to ask you, Cornelia, is there anything particularly you wanted to highlight that's different from the versions that we've looked at previously? I think the one thing I was aware of was we're doing the site visit, which I think you may have.
Yeah. Yes, Chair, just to say at this meeting, there's meant to be a discussion about the site visit that was requested at the last meeting, like an orientation day about the work of the Directorate. So it's open for discussion at this meeting. Our members want to go and officers want to go about it.
Did any officer come with a plan how that might work? I think Robert had some ideas about how it works. Obviously, he's not here. Just no. Sorry, Councillor Dear.
Yeah, Chair. I think it's a good idea for us to make some visits to understand, as we requested last time, last meeting, that about the children's referral system, children's assessment, and how quickly they signpost to other services. I think we need to know how do they operate these services. Thank you.
Any other comments about the need for a site visit? Anybody online got a view? While you're thinking about that, I think from my point of view, I think it'd be really helpful. I agree with you. I've certainly thought with the children in care, I know the strategy which is sensible to try and keep kids with their family or their kinship has always made sense to me, but it equally does run the risk that rather than taking a child into care, that they're at more risk. So I'd be very interested in understanding the sort of risk management framework that we use and how that's continuously reviewed to make sure the child is safe. That would be one thing I'd be particularly interested in understanding how that's done by officers, and I guess in partnership with other agencies and family, I guess. Any other thoughts?
Yeah, meetings. And we talked about the kinship and keeping children within family members, if it's not immediate families. I think it's a good idea if we can really see how do they provide these services, how can they assess safeguarding of the child if the kinship is agreed or taken place, whether the child is happy or there are any underlying issues. I don't know, how can we make decisions? I think it will be great to see or to visit them, if it's possible. Yeah, thank you.
I don't know if officers want to react to that.
I have my hand up. Chair, is it okay to say
Yes,
something?
Councillor, go ahead.
Thank you. Yeah, basically, I think there shouldn't be the presumption just because a child is erring towards kinship care that there is going to be that the child's going to be at risk, because the whole point is to keep the child to have some kind of relationship with blood ties, and the extended family having had an experience of private fostering and being aware of this kind of arrangement. It can work pretty well, because you have to look at the statistics in terms of how many children do well because they have to go into care. They have to be, sometimes it doesn't always work, and to have that extended family can be actually a very good thing. So I think it's something we should consider, going to have a better understanding of how this works.
Yeah, I absolutely agree with you. If my comments gave the impression otherwise, I do actually agree with you. It's just understanding the framework for me about how you balance those trade-offs between the advantage of staying in kinships versus a perceived risk potentially of. So
Absolutely.
I don't know, did you want to say something, Helen?
Yeah, it's just to really reiterate around how with the kinship arrangements that there is a social worker that will assess the family, and there'll be support in place if required for that transition and kind of supporting that family with those arrangements that are agreed, and they're agreed following a assessment process to make sure that that is the most appropriate place for the child to be residing. So it follows a framework, absolutely, and risks are managed in the same way they would be if we was looking at any other placement for a child. And like you say, and as Councillor has referenced, that being within the family, there is more positive outcomes generally. That's what kind of research informs us. So we do follow that. My paper also talks into a little bit about the referral routes, but you might want, like you say, a site visit, or might be helpful to think about kind of timescales in terms of red amber screens and strategy meetings taking place. Might be better on a kind of site visit, if that's more helpful.
Thank you, Helen. So I think coming out of this, I mean, you've got a few ideas. I suspect I should talk to Councillor Haley and just see if we can pull together. I don't know if she's on, but we can perhaps pull something together as well, add a few more points of things we'd like to see, and then give it to you guys to perhaps structure a sort of, I don't know, whether we're thinking a half day or just a couple of hours. It would presumably need to be during the day, right? Yeah. Yeah. Okay, good. Anything else before we close on that subject? Is everyone otherwise happy with the work plan? Anybody got any comments about it, or are we happy? Okay, very good. Right, so we can move on to the next item, which is, I think it's a substantive item, isn't it? Which is the send and inclusion paper. Was that from officers? So my understanding is that officers want to take the early help strategy, including the revised children's centre. That's item 8. Take that now. Yeah, by all means. Helen, are you introducing that? Are you? Okay, go ahead.
Okay, Thank you. So this report contains details of the progress being made on implementing the plan, which sits under the Early Help Strategy. The update will include an outline of the Best Start in Life programme and initiatives that we've recently been informed about from the DfE, and how the local delivery of the programme aligns and feeds into the broader Early Help Strategy and plan, and an update on the revised Children's Centre and outreach offer. This report will also map the referral pathways that we was just speaking into, and key touch points for families accessing early help. So you will be aware that the Early Help Strategy was developed for covering 25 to 2028. This was developed with partners, parents, residents, in parallel with the consultation that took place around the improving the early help offer through the children's centres. This sets out the strategic direction of the work towards an improved and sustainable model of delivery of the broader early help offer. I won't go into around the strategy and its development. We've spoken about that a number of scrutinies, and we're aware that that was developed in collaboration, and that piece of work has been taking place over the last couple of years to bring that to fruition. So as an early years and early help partnership, we have an agreed framework which provides core performance indicators which evidence the impact of our early help support in key areas and the impact for children and families and their outcomes. And like I said, as you're aware, on the 3rd of July, the Overview and Scrutiny Committee considered a call-in of the decision taken by Cabinet on the 11th of June around the improved early help offer and delivery of the Children's Centre and outreach offer. After careful consideration, the committee voted to uphold the Cabinet's decision. So just to give an update in where we are, on the 10th of September 2025, a judicial review claim challenging the decision taken by Cabinet on the 11th of June 2025 was issued at court. With advice from leading counsel, the council has submitted a robust defence to this claim. The papers are now before the court, and who will decide whether to grant permission for the claim to proceed to a full hearing. It's hoped the permission decision will be made by the end of November. However, we cannot be certain when the court will decide. So no children's centre closures have occurred, and the council will refrain from further discussions until the legal claim has been resolved. So that's just to give an update as to where we are. Children's centres continue to offer community outreach sessions with an aim to enhancing the engagement and reach more families in the community. As you'll all be aware, that was a big part in terms of the consultation and us looking at how we are making sure our services are more accessible to families. There is item 8, you have a table there that lists those outreach spaces. There's a couple of venues which are paused, and these are due to some maintenance work that is taking place within those sites, but we are still engaging with partners and looking to continue to deliver our services from those sites. So in terms of key touch points and referral pathways for families accessing early help, the Families First partnership programme aims to transform family support by creating seamless integrated systems and combines the strengths of targeted early help and statutory child in need work in a single multidisciplinary family help service. The principles prioritise early relationship-based support, reducing handoffs between teams and ensuring families receive the right help at the right time. So this promotes collaboration across agencies. This will be inclusive of social care, our health partners, education, and also the voluntary sectors, so that support adapts dynamically to changing needs. So the approach is designed to prevent escalation, maintain continuity, and avoid families having to repeat their stories, while aligning the national reforms under the Working Together to Safeguard Children and the Children's Social Care National Framework. So family help in Ealing is rooted in the principles of our early help offer. a proactive whole system approach that supports families as soon as needs emerge. The strategy reflects Ealing's commitment to delivery integrated child-centred services across the borough. So strengthening our community connections and ensuring that families can access support easily within their local neighbourhoods. So early help encompasses a wide range of services from universal all the way through to targeted support. These will include ECHAS, which is our Ealing Children's Integrated Response Service. This is a consultation line that people can call into and take advice and guidance. We have our Family Information Service. They provide information for families, including what that local offer is, what's available to families within the communities, how to access them, etc. We have our early help assessments and plans. So this is a early help offer that is supported and acts as a team around the family, and our partners can be lead professionals within those plans. We have our children's centre offer, which is around that delivery of early years services and family support. They currently focus on the 0 to 5 age range. Within the children's centres, we also have our Early Start 0 to 19 integrated health services. So this is about ensuring health and development needs for children aged 0 to 5 are met. We have one-to-one mentoring, which is delivered by voluntary agencies, which is commissioned by the local authority. Parenting programs and workshops. Also our mental health and wellbeing support. This is supported and delivered by our Safe Counselling team and Safe Evolve, and also our Safe Targeted Family Support. So this provides short-term interventions to families where you have emerging complex needs that weren't meeting threshold at the front door for a statutory service. An assessment would receive a assessment under the early help umbrella. So in terms of accessing family help services in Ealing, early help is about getting support as soon as you need it. There are two main ways families can access service. So you have our universal and community offer, which you can access directly within your community without going through the council's front door. We call it ECHAS. And then you have our children's centre offer, which provides the activities, parenting support, advice and guidance to families. This is out in our children's centre space, but also delivered within our community organisations and our outreach offer. And then we have our Universal Plus service, which gives extra help through our health visitors, schools and that voluntary sector. If families' needs should escalate and there is a need for more statutory, then we have what we call our ECHAS team, which is our front door, where families will be able to have that targeted statutory intervention. And there's contact details provided within the report, both for ECHAS and also for the Family Information Service, which offers family advice around universal services within the communities. At point 14, there is a diagram which highlights that referral pathway that we were speaking into earlier. So you have your ECHAS, your Ealing Children's Integrated Response Service, that will where families can be referred to either by partners, self-referrals, etc. And then a decision will be made at that point. What's the best service to support that family? We also have that Family Information Service where families can call into to find out what services are available. So the role of the Family Information Service is about clear, accessible guidance for families on local services such as childcare, education, support options, helping them navigate and connect with the right resource that's available to them. And ECHAS acts as a single front door for all inquiries and referrals, including multi-agency safeguarding hubs. So that kind of MASH element of identifying families' need. We have the supportive action for families in Ealing, so that safe workers are embedded at that front door point, and they will provide early help and intervention as an option if that's deemed the services that will meet the need. And we also have 2 dedicated early help and assessment practitioners that also are sitting at the front door, who will be able to work with the family on some of those emerging needs if it's not meeting that statutory need. We also have the local delivery of the Best Start in Life programme, which is a new initiative that we have. So this is the government's national Best Start in Life strategy, which was launched in July 2025. Its importance lies in breaking down barriers to opportunity and tackling child poverty. So this evidence shows that investing in the first 1001 days from conception to age of 2 shapes lifelong health, learning and well-being. So the cross-sector initiative has been designed to improve support for children, families and professionals who work with them. And the focus is on improving child development from pregnancy through to 5. So this is about our integrated health, education and family support services. Our key elements to include to expand our childcare, for example, our 15 to 13 hours free for eligible families. So the Best Start in Life programme is a national 3-year initiative. So it'll be running from April 2026 to 2028. We have ring-fenced in-year development grant to prepare for the delivery of the programme. This is 174k, which we will need to spend against by April 2026. For this, we need to identify a family hub by January 2026, and that will be at least 1 hub at this time, prioritising areas where we have high deprivation, where support is most needed. And the hub is designed to reach families and children of 0 to 19 and 25 where SEND is present. So that's where it differs slightly to a children's centre offer. 0 to 19 years. Yeah. And 25 where there is a SEND need, and that's where it differs slightly to that children's centre offer, which is more 0 to 5. It's also around preparing for evidence-based interventions, so preparing to deliver parenting and home learning environment resources for families with 3 to 4-year-olds, and this will be from April 2026, and this is to support to achieve our national target of 75% of children reaching a good level of development by 2028. This target that has been set for us is a substantial increase for us by just 0.5% between now and 2028. It will also strengthen local plans, so involves building on existing early years work, identifying local needs and gaps in provision, and developing an integrated plan outlining the strengthened offer for families and join up systems and sectors. We are currently undertaking a SWOT analysis to understand the strengths and weaknesses and opportunities and also the threats. And this will help us to deliver a robust plan to meet the objectives of the programme. Governance structures has been suggested for a programme delivery, and a project group of key stakeholders with suggested tasks and finished groups will be responsible for the practical development of this plan. We have under point 22, there is a governance plan outlined there in terms of how we anticipate that to evolve and make sure that we have direction and traction on the Best Start plans. So it's around we want to raise awareness across practitioners and partners who deliver early intervention support, and a series of Best Start in Life presentations are being delivered across the partnership. As this is a very early point in some of the presentations, we have delivered feedback, co-production workshops for professionals to share their unique perspectives on how they think we might take forward some of this work. We've also just had the Care Leavers Takeover Day, which was last Friday, and we done a group with care leavers around their ideas and thoughts in terms of what a hub might look like, what's important in terms of engaging young people in accessing some of those services, and that will also be fed into the plans going forward. And that's about all of the information that's in there. There's a little bit more detail, but
Well,
where we are with the children's centres.
thank you, Helen. That's very comprehensive. Does anybody have any questions on the paper they wanted to ask? I mean, while that people are thinking about that, sorry, go ahead, Councillor Dear.
Chair, I don't have any particular question, to be honest. I read this report thoroughly. I think it's a well written, you can understand, but the other changes, as Helen mentioned about the court case, we are waiting the verdict end of this month probably. Yeah, and I think changes will be in the future about the children's centers. So the children's centers remain the same as we did discuss in the past. The portfolio holder gave us really quite a detailed information. I think according to this report, there are no changes in children's centers. All children's centers are still open and functioning well, supporting families. Apart from that, I think it's quite comprehensive. Thank you very much, Helen.
Thank you. And your summary is correct. The children's centres are still open and functioning as prior.
Great, thank you for that. One question from me, and I don't know whether this might be something you're aware of, with the judicial review process. So my understanding from your answer and from the paper is that at the end of November, the court will decide whether they want to hear the case, essentially. Now, obviously, one scenario is they don't want to hear the case, so that's the end of that process. If they decide they do want to have a hearing, do we have an idea of the sort of timeline for when that hearing would be?
Unfortunately, I'm not able to give a timeline because we will be. It will be dependent on the courts, how busy the courts are, and they will set those dates. So I really don't have a time frame. If it was to be the case, we would hope it to be this side of the financial year, but we can't state that for sure.
Fair enough. And the financial year is April, is it?
April.
Yeah. I think you're right. I can't imagine it would be this side of Christmas.
No.
One other, not really a question, but just to get a sense from you about one of the things about being new to this is there's an awful lot of acronyms, an awful lot of programs. A lot of it sounds very good. Obviously, you're now kicking off, because of the Family First strategy, you're kicking off a whole load of other stuff to try to mesh into it, which is understandable. To what extent is that overlapping with things that you were already doing, or creating any kind of disruption to the sort of plans and strategies that you already had ongoing?
Thank you. I don't feel that there is any disruption to what we are doing. I think quite the opposite. I think it supports and enhances some of the work that we want to drive forward. In terms of the Best Start in Life agenda, much of that is around outreach and how we meet families in spaces and places where they feel that services can be more accessible. It's around that development of the like I say, the GLD, the good levels of development, and the increase we need to be making there. So a real focus on that early start, which is in the strategy under our priority of Best Start in Life. So actually I think the programs and the initiatives coming through are really supporting us to take forward some of this work. Equally, as you mentioned, the Family First partnership, there's crossovers between Best Start in Life and the Family First as well in terms of ways of working, and the documents are referencing each other through their literature. So again, there's an enhancement in that in terms of Family First work is around taking our services out into the community. I think we're taking we're moving into Southall with our Family First and working with families out in the community there. And the offer very much is about the focus on early intervention at that earliest point, and families being held kind of in that space as opposed to going into statutory services. So I think they very much complement one another and the vision that we had within the strategy. Thank you.
Thank you. I think we have a question from Councillor Kwasi. Kwanzaa.
Kwanzaa. Yeah, how will outreach reach families who don't usually engage with children's centres? How are we going to? I'd like to know a bit more about how we're going to manage this, please. Thank you.
Thank you. So in terms of an outreach offer, we do currently have an outreach offer. We have that kind of listed out under item 8 of the paper, but it's around how we further grow that. So we want to be working more closely with our voluntary and community sector, who are engaging with families that we might not be seeing coming through to the children's centres, but they've already developed those relationships. So it's around how we align our services. And like I said, the Best Start in Life agenda is really supporting to drive that forward and think about where we're able to invest in some of those resources and some of those voluntary and community sectors. So it is an ongoing project and programme, and we will see that grow over the next 3 years with the Best Start.
Thank you. And another follow-up question: will early help receive stable funding so services don't keep changing?
Again, that's a hard one for me to answer.
Sorry.
Would it help, Helen, if I reminded Councillor Kwanzaa that it's us who set the authority's budget, and
of course
we agreed that we should direct resource towards outreach, as you may remember. Certainly the government's assistance is very welcome, and the 175,000 thereabouts that Helen mentioned in terms of setting up the Best Start programme is really helpful, and the government is investing in that, and that's the difference a Labour government makes. And I think we will shortly be kind of be able to talk about the further funding we're getting as part of that programme, and the new activity that we'll be able to do. And I can see Helen nodding on that. So it's our decision how we spend our money, and we set a budget every year, and I think we know what we need to do with it. And that outreach activity is probably the best way to do it in terms of the prevention agenda that we've spoken about before.
Brilliant. Thank you.
Thank you, Councillor Blacker. I think we have another question, and I can't see because my eyesight is not good. So Sade. Sade, I think you've got a question.
Yes, I do, Chair. I agree. The paper is very comprehensive. I just wanted to tease out a little bit more information. So, Helen, you mentioned the early help strategy, and obviously there's various programs for children and young persons between sort of 0 to 5 specifically for the children's centres, for example, or 0 to 19. Naturally, obviously, you mentioned that there is support for individuals, particularly with SEND, up until the age of 25. And I just wanted to understand sort of what initiatives or programmes are in place for, I guess, between 19 to 25, or covering that age range for individuals with SEND, please.
Thank you. So in terms of the development of the plan, we're working very closely with the SEND team. There is a SEND strategy, so we want to make sure that we are not kind of duplicating and working across. So the programmes that are available across that broader 0 to 19 and support for SEND, it may look at around transitions and how we support young people transitioning through those stages. So we have 5 priorities within the strategy. So inclusion and transitions being one of them, and much of that SEND element will sit within that part of the early help strategy. And like I said, we have our SEND strategy that equally has that kind of outlines the support for children with SEND. So it's just that kind of crossover point and how we complement one another.
Thank you.
Thank you. Is there any more questions from anyone? I don't think so. I think we can wrap that up. Thank you very much, Helen. That's very helpful. No. Are there any recommendations that anybody would like to make in relation to the paper? I mean, I think the one that came out from what Sade mentioned, maybe bringing out that interaction with the SEND program and how that's going to work with the early years would be helpful. Just to understand what the intercept is between the two sort of activities. Okay, so I think we can move on then, and I don't think there's any more comments. To the last substantive item on the agenda, which is the overview of SEND and inclusion. Aretha Banton is going to lead this off. I'm sure I'm not alone in having read through it, and as Aretha and I discussed, it's quite a big paper. There's a hell of a lot in it. It was quite a tough read, if I'm honest. So what Aretha and I thought would be helpful would be if we went through it sort of section by section. There's about 5 or 6 sections. Aretha would do a sort of 2-3 minute intro, and then we could just pause if there's any questions or comments or clarifications, and then we'll move through it that way. And I think different officers will come in at different sections anyway. So unless anybody's got objections to that, I'm going to hand over to Aretha to kick off. Is that okay? Thank you.
Thank you, Councillor Oxley. Okay, so it is a meaty document, as Councillor said, but we tried to cram a lot into this document to give you a real sense of the work that's going on in SEND and inclusion that has been going on certainly over the last 2.5 years in terms of preparation for inspection, but also just looking at some of the improvements that we've made quite rapidly and those noted today. So we're going to provide a very comprehensive report on SEND and inclusion, covering key areas, including our recent Ofsted inspection, our EHCP performance, SEND place planning, early intervention and outreach, community and parent carer involvement or co-production, children missing education, children missing out on education, and SEND transport. So to give a bit of context, so children and young people SEND may require additional support to access learning, participate fully in life, and achieve the best possible outcomes. We have statutory responsibilities under the Children and Families Act 2014 and the SEND Code of Practice to ensure that we are supporting those children with special educational needs at SEND support stage, which is before they get an EHCP, and more importantly, at the EHCP stage where we have statutory obligations to provide provision following a comprehensive assessment of their needs. So nationally, you would have heard quite a bit on the news over the last year or so, particularly around finances, but particularly about the growing demand in SEND. And there's a national trend in which, as of January this year, it's an annual survey that comes out, but approximately 1.77 million pupils, nearly 1 in 5 school-aged pupils have been identified as having SEND. And if you think about a classroom of 30, you've got 1 in 5 in that classroom identified with additional needs. Of these, 482,640 pupils have an EHCP plan, which is a rise of which is an increase of 11.1% in the past year. So you can see that actually nationally the trend is going upwards. Locally, we mirror the national context. So you'll see in the report that our last count in October 2025, 41% of pupils had EHCP plans and were attending mainstream schools, whilst 8% were in our mainstream resourced provisions, and a further 27% were in state-rolled special schools, with 7% attending independent and non-maintained special schools and 8% continuing education in further education institutions. Pause there. In the census, you will also see that there's a steady increase in SEND prevalence in both primary schools and high schools, mirroring the national trends, with the percentage points seeing an upward trajectory over time. In Ealing, our SEND educational needs align with the SEND Code of Practice, where there are 4 different categories of need, with diagnoses or subcategories underneath each of those needs. Out of the four, the most prevalent need is communication and interaction needs, with 8.6% of pupils having this as their primary need. So often there is a primary need recorded and a secondary need recorded, and of the primary needs, that's our count of the most prevalent. This means with speech and this communication and interaction also includes speech and language, which is the highest need overall, and autism, which is again one of the highest diagnosed needs in the local authority. So over the past 5 years, Ealing has experienced a substantial rise in the number of EHCP plans, so education, health and care plans, with figures climbing by 51% to reach 4,000 or over 4,000 plans in June 2025. We're now closer to 4,500 plans. This growth includes a 9% increase from between January 2024 and January 2025, and the prevalence now stands at 4% across all age groups. I'll pause there.
Just briefly, any questions on the date? I mean, I had a couple of points. I don't know if anybody's got any points. I'll just go ahead while I check in. And this may be to do with the graphs and what's in the text. It says 3,649 pupils had SLCN, the speech language communications that you mentioned. When I look at the chart, it looks like there's 1,000, and I couldn't correlate that number with what's actually in the chart when I read it against the axis. I don't know if that's a typo or if I'm misunderstanding the chart in relation to the text. I don't know if you've got that.
Yeah, so I think you're right. There might be a bit of error, but when I looked at the chart, I was looking at it in terms of the primary need, whereas the figure I think relates to primary and secondary need.
Okay. Maybe we could just update that in just so the paper, because we'll be. I think a lot of us will refer back to this because it's a useful repository of information. And similarly, under growing demand, it talks about the prevalence of EHC plans now stands at 4% across all age groups. And then it said primary 6.4 and secondary 5.7. Now, maybe I'm just not very good at maths, but wouldn't it be an average of that? So somewhere in between those two numbers, I didn't know why it was 4%, and then you had two higher numbers. So that was, I just had a question about that. You can come back to these. I mean, we don't have to discuss them in.
Because I'm not great at maths.
It's the average per year group rather than combined. So the one figure combines both, but then it's the average per group. So primary of all the population, secondary of all the population, and then
one is combined and then one is separated out. I think if it's combined, it would be between the two figures. It would be between 5.7 and 6.4 rather than below both of them.
Let me take that back.
Yeah. Anyway, if you could make that back. Was there any other questions on data or any other questions generally about context? Councillor Deer.
Yes, Chair. Rita, you talked about the rise of SEND rise. I think it's 11.1%. It's a huge rise. It means it's a 6,025 pupils in 1 year. 11.1%. So it's a huge, really, rise in 1 year for children to have these problems in plain English. Do you know what is the reason why children are going through this path? Is there any reason? Is there any research?
Yeah, it's probably the $1 million question nationally in terms of what's
what's contributing to a rapid rise, and many local authorities would have seen, particularly post-COVID. And I know we say that's over now, but actually, after COVID, we did see a huge rise in speech, language and communication and social, emotional, mental health needs coming through the system, and school avoidance. So we haven't, I don't think nationally we've got the answers to that. I don't think we've done enough research to bottom out the reasons behind the escalation and a rapid escalation. Locally, I think there is just a lot going on in terms of the mixture of the demographics within schools and trying to get children the right support at the right time. And that's why our strategy will focus on early intervention rather than providing the plans at the end point, because research does show the earlier you get in and support children, the less escalations that happen later on in life. However, I can't give you a definitive answer because I think there's lots of different things that would add to that nationally.
Thank you, because it crossed quite a lot of questions in my mind. What is the reason? Really, what's going on in communities? How can we pinpoint to that problem? How can we resolve this problem? Because it's the local authority's statutory duty to provide these services. Yeah, I think there are a lot of questions in my mind. Like, for example, during pregnancy, they do check the child's progress and they tell you if there is something going wrong. But even then, for children, you are talking about the COVID period. Children, yes, they stayed at home. They never been to schools because they didn't communicate with anyone apart from family members. Yeah, these are the good reason. But I think there must be something else which we don't know yet. Thank you. Thank you.
Just to build on Councillor, and I'm curious about this because I can see that COVID was obviously a huge event, would affect and did affect. I know that because I've got kids and I know it affected some of my kids in the cohort they were in. But you know, it was actually a while ago now, 20. So are we seeing any improvement in? It doesn't look like it, the SEND figures for primary schools. I just wondered when you look at the very early years, people entering schools now in reception year one, whether there's now we're seeing a reversion to how it was pre-COVID, or is the trend still rising?
I think we will see a reversion, given that we know more than we did then in terms of the impact of not going to school, in terms of the impact of not communicating and being in a social environment, and actually how that can contribute to delays, whether it contributes to delays which end up in any HCP or a different matter. I think what we're seeing is that those year groups working their way through the system as well. So we'll get bulges at certain year groups where actually they have been affected by, you know, in adverse ways by not being in that social environment, and that's not worked its way through the system yet either. But I don't want to pin it all on COVID because I think that's a contributor, but not the driving factor. We've also got better diagnostics in health, for example. So you pick up autism a little bit earlier than you would have traditionally. Things like ADHD, you pick up earlier and you get diagnosed earlier. So all of those things kind of contribute to what we call the rise in numbers. It doesn't, whether or not that's an indication that needs have changed or we're just more aware of those needs at an earlier point. It's kind of swings and roundabouts, I think.
Thank you for that. I don't think we have any other questions, so we move on because we're to the next section.
So the next section really.
Oh, Shade, do you have a question you want to make?
Yes, yes, Chair, sorry, apologies. I'm not sure if this is a comment or a statement, so bear with me, but I'm quite interested in, it's not something you spoke about, but it is in the paper, and it refers to the pupil referral units and the fact that the most common need in PRUs are the social, emotional, and mental health needs of children. I don't know if it's a historical thing, but my understanding of PRUs sometimes obviously is that children with sort of challenging behaviour and so forth, they may be excluded or suspended or whatever the case may be, but at some point they end up moving to a PRU. I think I'm sort of just keen, I don't know if you would know this, but is the, are these children, did these children already have a recognised SEND before moving to PRUs? You know, in terms of the social, emotional, and mental health, or is it something that's being established or something that's been noticed once they are in the PRU?
I think it's a combination of that, if I'm honest. There would be some children who are in the PRU for a one-off incident, for example, rather than a pattern of behaviour, and there's some children that will be in the PRU for a pattern of behaviour that's then culminated in an exclusion. I think some of them will be in the PRU and get picked up, and the special educational needs will be assessed once that's happened and they're there. But a lot of work may well have happened before they get there, but maybe it's either coming too late, or it's not been impactful, it's not been effective in the way that people had hoped it had, and you still end up with the exclusion at the end of it. So I think our PRUs are really good at, when they do get the children, doing a comprehensive assessment in terms of really getting to the bottom of why things might have gone off track for that young person, and trying to get them back on track through really targeted interventions. So I think they're really good at doing that. I think often when we're looking at social, emotional, mental health, it's quite a big category as well. So it can include a diagnosis of ADHD or ADD, but it can also include an eating disorder. It can also include trauma. It could also include anxiety disorder. So it's a really big range. And within all of that, what you get is behaviours that are different, but they could be expressed really differently. So anxiety can be expressed through aggression, or it could be expressed through withdrawing. So it's a really complex category anyway to bottom out, the answer to your question. In addition to that, it could be a secondary need, or it could be a primary need. So you might have comorbidities in there as well. So it could be a diagnosis of autism plus anxiety disorder, which then creates, some difficult, challenging situations for that child if we don't manage it correctly and if we don't intervene at the right time. So there's lots and lots of different nuances. So it's quite hard to give you a definitive answer again, because SEND is, and I said this earlier in the workshop, SEND is messy, and it's exciting because it's messy, because you've got all of these questions that you're quite rightly raising here, because it gets you thinking about the why. And so that's part of the work that we've been doing, is trying to drill down into the why quite comprehensively. We're not there yet, but we're getting a real good sense of the local demographic and maybe some of the underlying reasons why people go down the routes that they do go down, and the optimal point for in early intervention that Maddie's going to talk about a bit later on. So I know that's maybe not an answer.
No, that's okay. Chair, may I ask a really quick follow-up question? In terms of early intervention, is there anything that you've sort of identified where it may be possible to intervene perhaps before? I'm just using exclusion as an example, because that historically that what often was the case for individuals being excluded and then moving to a PRU. But is there anything in place to either around the time of considering exclusions, for example, or moving individuals to PRU, to assess before they get moved from their mainstream school, for example, to a pupil referral unit?
Yeah, I think schools have really good toolkit. They have obviously they've got the SENCO in post at schools. Many schools will have behaviour leads, they'll have attendance leads, they'll have teams of people that are non-teaching staff that can build those relationships. And certainly from the research that I've seen, it is about the relationships and forming those relationships with a trusted adult that makes the difference. Sometimes it works, sometimes it doesn't work, because maybe that child is not at that point yet, and maybe there are different contributing factors that can delay that relationship being built. For example, if a child suffered trauma, then there's a lot of work to be done to establish a new trusting relationship in order to get the outcome of, the full impact of that relationship with the adult. So I don't think there's a hard and fast rule, because if there was, I think nationally we'd be seeing a downward trajectory in exclusions, and we're not. So I think very much it depends on the school, their behaviour policy, and then how they kind of enact some of that support around their behaviour policy, and any reasonable adjustments they may deem to make for children with special educational needs within that policy.
Thank you. Probably best if we move on to the next session, I suggest, which is the
Inspection.
The inspection.
Okay, thank you. We've just been subject to an Ofsted inspection for the local area partnership. That is a joint CQC, so Care Quality Commission and Ofsted inspection, which lasts approximately 3 weeks, with some on-site work and some desktop analysis. So the inspection recognised significant strengths within the partnership, particularly around strong leadership, our commitment, the workforce's thoughtfulness and dedication is cited in the report, inclusive education practices and early identification. There is always further areas for development in the report, and we have listed those further elements in the paper, particularly in regards to timeliness, quality of plans, communication, and for health. There are some notable recommendations around waiting lists for at least 3 of their services. Out of the outcomes, there are 3 outcomes for inspection. One is consistent positive arrangements. The second, middle grade, is arrangements that lead to inconsistent experiences and outcomes. And the third is serious outcomes where there are systemic failings. The judgment for Ealing was the middle grade in terms of inconsistent outcomes. It was noted in the inspection feedback that the inconsistency of the outcomes was because our plans were quite new, and so it rippling through the system in terms of that consistency wasn't quite there, and they used the word yet. So what they basically said to us is, you're on the right track, keep going, keep responding appropriately to local need, and you will move up and we'll see the improvements bed in. Did you want me to go through the recommendations or take those as read? I think I've summarised it enough.
I think people will have read that. I don't know if people have got any specific questions. I guess I had just a couple around it. First of all, well done for surviving the inspection. I'm sure that was a tough process to go through. Just a factual question: where were we previously when we were inspected? Which grade? And I guess a related question: how do we compare with other London boroughs that are comparable? Do you have that information, or could you get that for us?
We could do a chart which says, where London boroughs who have been inspected have come out. I think it would be really difficult to map over borough by borough, because we all are very different in terms of our demographics, in terms of our structures, and in terms of our partnerships. And so even if it looks like we're neighbouring boroughs, actually it might not be like for like. And so I'd caution any kind of extrapolations on that table if we do present here. I think in terms of the previous inspection, it was requires improvement, which is termed as RI. We were inspected under the new framework, that was under a previous framework, and there isn't really a read across between the 2 judgments. But the sense that we got, we're definitely in the right trajectory. And we if you read the comments in the report, the flavour is slightly different to the previous inspection.
Thank you. I would like to see the table. I appreciate your points about comparability, but I think it would be useful to see how other boroughs have compared. And if you want to add commentary about, whether they are comparable or not, or things that might drive outcomes, that's fine with me. Did anyone else have any other comments at this stage on the? I suppose the final one is you've got the 4 areas they've identified. I know it's early because it was very recent. What's the sort of plan to address them? Are you going to have a program to address them, or do you feel that they're being addressed, or how are you going to monitor or know whether you're working towards addressing them?
So as a partnership, we are required to do a post-inspection action plan based on the recommendations. So that is in draft at the moment. A lot of the work aligns very much with the extracts from the report in terms of the areas for development, areas for improvement. Some of them have more urgency than others. For example, waiting lists have a bit more urgency in the report. We were quite fortunate that when we drafted our self-evaluation for the inspection, it was quite comprehensive in terms of outlining where we had real strengths and real areas for development. And so a lot of that work has already been done and can be drawn into that report. We also have our STEM strategy, which is in its final year, which also has lots of actions behind it and lots of progress behind that as well, which we'll be evaluating alongside the post-Ofsted plan as well. So there's quite a lot of activity already in the business as usual kind of framework. And then we'll have kind of a higher level Ofsted plan, and we plan to work with some advisors around, what's working well nationally and trying to get some innovative practice within those reports in terms of actioning. And then also looking forward to the SEND strategy from 2027 and drawing some of the elements forward for preparations for that strategy document to be released and published and drafted, co-produced with the President.
Thank you. I'm sure I'll check with Councillor Haley, but I would imagine the Scrutiny Committee would be keen to look at that post-inspection action plan at some point and have a look at what we're doing off the back of it.
Yeah, we're aiming to submit it to the DfE by December, end of December. So.
Yeah, so we might want to incorporate that. I don't know if we can fit it in before the election or whether it will be in the
December.
Not one in February.
Yeah, February. I mean, it could be circulated without a meeting.
And we can decide whether we want to have a in-person. And there's no more questions, which I don't think there is, unless Councillor Blacker, did you want to make any comments?
Yeah, I was just going to just kind of echo what Aretha said, and also I think we should put on record my thanks to her and the team for getting us through that inspection. I know, as you said, it was a lot of work, but just to echo what she had said in terms of that yet bit in terms of our plans and your question about what are we doing off the back of it. I don't think there's much that we're doing off the back of it that we weren't already doing. And I just wanted to echo that and just make sure that had come across really clearly, because it was very clear going through that, yes, there are some issues and problems we need to address, but we knew about them. And the partnership was already looking at those problems and how to address them, and there. So a lot of the kind of the action planning we're doing is taking our previous action plans and writing it up in a new way for DfE. So I just wanted to reiterate that and just make sure that we were kind of clear that we had a good understanding of ourselves as a partnership, and then just to thank Aretha again.
Thank you for that, Councillor Blacker. Yeah, so if we've already got it in train, I guess the action plan will just sort of link in with those things. So thank you for that. Any other questions before we move on to the next section? Have we got any? Oh, we got a hand up, I think, Sade. Yeah.
Yes. I don't know if you know the answer to this, but is it possible to identify whether there are any sort of disparities between disparities between inconsistency and quality of EHCPs? Particularly for the slightly more deprived areas of the borough or low-income families. And I think the reason I'm asking is because in a previous life, I assisted as a SEND tribunal representative. And I'm aware that some families that that had a slightly higher income, they would independently get assessments and things and ensure that they've got, challenge the EHCP. And try and champion the education provision they felt their children needed. And those in the know would obviously try and get assistance from charities that could support and so forth. But those that are just not as aware that they can either challenge the EHCP or aren't quite clear of the quality, is it possible to identify that and potentially bridge that gap?
I'm not sure whether the gap exists in the way that you're presenting it out as. I think the quality of the plan doesn't rely on the child's background, the context. The plan is the plan. I think what you're alluding to more is maybe more affluent families being able to afford private assessments, which then speed up the process and provide different levels of provision because they've got an independent assessment versus being stuck in a waiting list for the NHS assessment, for example. So I think it would be really difficult to get that kind of disproportionality out without looking at every single plan attached to that child or that cohort of children versus the other cohort of children, if that makes sense. With over 4,000 plans, you can see where I might be going with this in terms of the time it would take to bottom that out. I think one of the good things that we are doing, though, is we have within ELP, there is a race equality forum where we work with parent representatives from various local organisations representing a range of diverse parents out there, particularly those that don't feel like they've had a voice in the past. And that trickles out into some of our schools' work directly, with some schools taking on their own parent race equality forums within their own school. The second thing that we do is report and work alongside ELP, but with the Citizens Tribunal on race equality, and part of that work is trying to number crunch some of the facts, some of the concerns that you're raising now, and trying to get to the bottom of it. But I don't think we're able to answer your specific question, because it would mean going plan by plan and then looking at background and then looking at context. If it was a bigger question around data and trends, we probably could answer that. So I can give you an indication of disproportionality that we've uncovered recently. One is about the rate at which children get their EHCPs based on kind of looking at ethnicity, and we can see a lag there. So about a 2 or 3 year lag between children from Black African, Black Caribbean families getting that EHCP versus other groups of children who might get it maybe 2 years earlier. So we are kind of unpicking that data, and we are quite intentional about doing that now. And we are reporting to various forums around how that is done. So if, you know, I'm more than happy to have a deeper conversation with you, but Madhu is also part of that, and she will be able to talk to you about the work that ELP do in that area.
Thank you. You anticipated my next question, so that's helpful. Thank you.
Thank you. And maybe I can add to that, in addition to sort of race, the data around race, but also social class, because actually if it's about money, it's often about social class. Can't believe I'm the one saying that to Leif Gatzel, but yeah, I mean, it would be good to see both of that if you are able to pull that out. If everyone's happy, perhaps we could move on to, which is related to processes and performance section of the report.
So to begin with, an education health and care plan is a statutory document.
Do you want to introduce yourself first?
Oh, yes, sorry. Good evening. Fabiola Peacock, Head of SEND and AP Services. Okay. So as you said, I'll be giving a brief summary of the EHCP processes and performance. So to begin with, an EHCP is a statutory document for children and young people aged 0 to 25 whose needs are significant and complex and cannot be met at the standards and support available in mainstream schools. The process starts with a request for assessment, which can be made by parents, carers, young people themselves, or settings, or it can also be triggered by a relevant professional bringing the child or young person to the local authorities' awareness. The local authority must decide within 6 weeks whether to proceed with an assessment. And if we do proceed with the assessment, a multi-agency assessment follows with professionals across education, health, and social care alongside the family. Where the needs are confirmed, the EHCP is drafted, setting out the child or young person's aspirations, needs, outcomes, and provision required to meet those needs. Now, the whole process must be completed within 20 weeks, and each plan must be reviewed annually to ensure that it remains appropriate. In terms of challenges, like many areas nationally, and like Aretha mentioned earlier, we have seen a significant rise in EHCP applications, around 51% over the last 5 years. And as of June 2025, as you saw in the report, the number of education, health and care plans in Ealing reached 4,039. It's now, like Aretha said, closer to 4,500. In June 2025, we know that was represented an increase of around 9% in the last year when we measure from January to January. Sorry. Staffing levels, however, haven't kept up with the pace in relation to the increase in numbers. national shortages of educational psychologists, team development needs, and delayed advice from NHS therapists have all contributed to delays in the process. Despite these pressures, and as mentioned by Ofsted and picked up by Ofsted, we have made notable progress. We have strengthened collaboration across services, including SENAS, the attendance team, social care, NHS therapies, early years, and educational psychologists. We have introduced robust case tracking systems, which allow us to identify and address unallocated cases swiftly, reducing administrative delays. This has meant that the majority of assessment requests are now seen within 2 weeks from referral. Now, if you compare that with the statutory deadline of 6 weeks, that is a significant improvement. In terms of quality, as of June 2025, 63% of our EACPs are rated satisfactory or above. We do, however, recognize that there's more to do, especially in relation to ensuring the golden threads is achieved and the authentic voice of children and young people is reflected consistently in all of our EACPs. We have also worked hard to clear the backlogs, and by July 2025 was the first time that we saw more EACPs issued on time than not. As you can see in the graph included in the papers, you'll see that timeliness continued to increase. And if you compare, for example, 31% achieved in June to 61% in September, that trend continued to increase. I believe we're now at around per month. In October was around 70%, and it continues to increase. Now, looking at ongoing risks, recruitment and retention of speech and language therapists and educational psychologists remains a challenge, with over-reliance on agency staff. To address this, we have launched the educational psychologist workforce strategy, aiming to reduce agency reliance by 60% and achieve a permanent vacancy rate below 5% by 2027. Moving forward, our focus remains on sustaining these improvements, further strengthening our workforce and ensuring that every child and young person receives timely and high-quality support. Any questions? Sorry.
Thank you, Fabiola, and you can have a drink now. Any questions? While people are just thinking about that, again, it's a very small, slightly annoying question, I suppose. Just in terms of the data in the text, and maybe I'm being slow here, but when I look at the graph, you say, and by the way, congratulations on it improving. That's the big picture, and that's the most important thing. But the paper talks about June 31%, September 61%. But when I look at the graph, June is 38% and September is 86%. Am I misunderstanding the data here?
No, you're not misunderstanding the data. It's probably not clear enough in the paper as to what we're referring to. Right. So there are two different measures being referred to. And when Fabi was just going through it, I knew this question would come up, actually. Sorry. Well, I grabbed the microphone for that. But yeah, so we've got a DFE timeliness figure, which is from January to December every year. It doesn't run within financial years, and it's your timeliness figure that's reported to the DFE. And the graph is showing you your month-by-month figure. So there'll be different metrics, because one is calculating just the figure within that month, whereas one is calculating the figure year to date, from January year to date, and that's what's not clear in those figures. So you've got different figures, but the most important figure from some of this is the DFE figure, and making sure that that's above the national average, and by the end of the year it should be above the national average.
Great. I mean, I think if you can amend that in the paper, just to make it a bit clearer, because to the reader it's a bit confusing. Thank you. So the next session is place planning. I'm not sure who's speaking to that.
I'm going to speak to that.
Okay, thanks.
Okay, thank you. So as noted earlier in the session, we noted a rapid increase in EHCPs and rapid increases in certain areas of need within the categories of need as outlined in the Code of Practice. What we have to do therefore is look at our school placements to keep up with that growing demand in terms of children who may require a specialist provision, whether that is a unit attached to a school, which we call an SRP, so specialist resource provision, or an ARP, additional resource provision. And those definitions are in the paper, noted in the paper anyway. And then you have the next kind of tier of need, which would be a full specialist school. So those provisions are what we define as specialist placements. And then we've got our mainstream schools, which will have most of our children in there anyway. So what we've been doing over the last few years, certainly the last 5 years, I'd say, is really trying to ramp up the amount of provision that can support children with complex needs, whether it's in a mainstream school, resource provision, or a specialist school. In order to do that, we have improved our transition planning, so really looked at some of our data and making sure that we're able to pick up and forecast the number of places that we'll need way in advance to ensure that any capital work and any kind of financial work and governance work and DFE approvals are done way before that transition phase takes place. We've also strengthened our partnership with further educational colleges. So what you will note in the report is the high number of children who are post-16 but in non-maintained independent schools. And in order to kind of bring that number back in line, what we've done is worked really hard with our further education colleges to ensure that they have provision that can also meet need, rather than everyone going to a maintained an NMI provision, so non-maintained provision or independent school. We've also done a lot of quality assurance around our non-maintained and independent schools, making sure that we only use providers who are rated in Ofsted old money, I guess, good or above, and who comply with our additional quality assurance and safeguarding metrics that we have worked with other local authorities on. In order to stand up the provision, we've created an additional 737 places between 2014 and 2025, and we've been able to do that because of our strong working relationships with schools and the provision that we provide to schools, so the support we provide to schools to enable them to be ready for opening and be ready for accepting children with complex needs. And I think most of that's covered in that summary. If you leave it there.
Thank you. I don't know if people have got any questions. I had one which I thought was fascinating. On page 25, you talk about the same code of practice and the child's parents having a right to request a particular school, college or other institution. I'm kind of surprised that that's in, I don't know if that's our code of practice or the government's, but it kind of leaves us you guys in a very tricky position, because they can simply insist on going to an independent specialist school. And I just wondered how you've found, because you obviously the code does give us some wiggle room to say, well, it's got to be suitable. And I just wondered how you navigate that tension between the rights of the parent to do that basically at our cost, and you being able to sort of constrain that or manage that.
Yes, so we always try to balance both parental preference as well as being a local authority who's a public service. I would say that the majority of times we do comply with parental preference, particularly when it is a maintained provision. Now, in terms of NMIs, we do a lot of work with parents. We attend mediations. We try to explain, what's available locally. Also, our duties to ensure the efficient use of resources. We often get the schools to meet with the parents, for parents to visit. Quite a lot of the times, parents, once that has taken place, they are more willing to accept our local provisions. Sometimes it means that tribunal cases now, hearings are taking close to 2 years to be seen. So parents often have sort of send their children to schools and it has happened actually quite a few times. By the time that the hearing comes, they've been in the school, they've settled well, and they end up accepting the provision, and they do like it. Now, obviously, parents do have the right to mediation and tribunal. We do have tribunals, live tribunal cases now, where parents want an NMI, and it is about balancing, both settings being able to meet needs, what is the cost, because you also have to consider the cost not of just the provision. Sometimes there are therapists involved, and also transport. And when the cost is significant and there's evidence that both settings can meet the needs just as efficiently, then there isn't a duty necessarily to comply with that parental preference. And the courts would often consider that, the cost to the public purse.
Thank you for that. Any comments on this section? Doesn't look like it. I think we can move on. Thank you very much for that. So I've got slightly lost. Where are we now? Early intervention and outreach, I think, is the next section, if I'm not mistaken. Yes.
Thank you. Hi, good evening, everyone. My name is Madhu. I am the ELP lead for Send and Inclusion, so ELP Ealing Learning Partnership, which I'm sure you all know lots about. So I'm just going to share some updates with you, or information with you around early intervention and outreach, which essentially is supporting mainstream schools to provide the right support at the right time, so at the earliest point, really. So I won't read everything here because I know you've read the reports. I'll just draw on some key elements. So in terms of strategic leadership, we have sort of three main kind of channels, really. So we've got our priority one of the SEND strategy, which is about right support, right time, early intervention guidance for settings and schools. And then we have two ELP committees in particular where SEND and inclusion is a key focus. So we have the SEND and Inclusion Committee, and then we also have the Learning and Achievement Committee, where outcomes for children with SEND is discussed in that space. We've got those three sort of main kind of functions and groups, if you like. So we try to embed early intervention through our ELP structures that we have in place. We have now got SENCO clusters. So we started this off last year. We piloted the year before, and last year all our primary schools are involved in the SENCO cluster. So that is, we've split up all our primary schools into 5 cluster groups. The head teachers meet of those clusters every half term, and then we also meet the SENCOs of those schools as part of a SENCO cluster. And that's where we, there's sort of 12 to 15 schools in that cluster, and we really talk about the leadership of SEND, talking about sort of local challenges that they have in their schools, sharing best practice, etc. So we can really kind of ensure that SENCOs are really held within that space. We also are piloting a secondary SENCO cluster as well, and we're going to see how that works this year. So we're piloting that. Alongside the clusters, we also have networks, SENCO networks, that take place half-termly, and those networks really are to be able to update on national priorities and our local priorities. And we have colleagues from across the SEND partnership coming in and sharing updates on their service offer, speech and language therapy, etc., etc. In terms of secondary, we have networks there as well, but we also, and we'll answer one of the questions around the exclusion conversation we had earlier, we have seminars between the SENCO and the inclusion lead. So both colleagues from the same school come along to the seminar, where we can, again, we give them chance to, we facilitate opportunities for them to unpick practice in their own schools together, and we sort of guide those conversations, and then they get to share good practice. And we really have enhanced and raised the profile of SEND within our head teacher briefings. All head teacher clusters have had a SEND focus as part of their peer inquiry review. We also, something that we're really proud of, and it happened through our SENCO clusters actually, we have an OT that works for us. Because obviously we know OT is quite difficult to source from the NHS, so we have recruited our own OT as part of the ELP outreach offer, offering universal sort of guidance, training, etc. And through the training that the SENCOs have had and the difference that's made, we actually managed up, and all our head teachers have now had training on sensory needs, which is having an impact on the provision obviously in school, because they're better understanding movement breaks, sensory rooms, the purpose and what they're there for, and that's having a shift within the provision in our mainstream schools. So just get a sense of kind of some of the impact and how how those sort of strands all interlink with each other. We have, I've got it here. I can send this to you if you like. I'm very proud of this. We have worked very hard last year on creating our ordinary available provisions document, and this document supports practitioners in schools to understand the shared expectations across the local authority for every child. So it talks about universal practice that we would expect to have in our schools, questions that teachers should ask themselves if they're worried about a child, really to unpick and get to the bottom of, okay, why is this happening? What, you know, I'm noticing something a bit different. Could it be this? Could it be this? Could it be this? Their roles and responsibilities, etc. And then with the 4 broad areas of need at the back of the document, there's practical strategies that teachers can implement. You know, and this is all universal provision. So really what we'd expect to see in all our schools, and that's how we're going to raise consistency and sort of standard and quality for all our children. So yeah, we're really pleased that we've managed to do this. It's a big piece of work. And now this year we're working on an early years version. So that's our project for this year. But if you would like it, I can send it to you. Okay, and so within early years, as I just mentioned, we have a few different groups there. We have an early years strengthening group, and we have the early years and early help partnership board. And in both those spaces, we talk about improving outcomes and improving the experience that our children are having within early years. So we offer a bespoke support package. We have some advisory teachers that go in and they'll do bespoke work in schools, but they also offer a raft of training for teachers, for teaching assistants, and also for head teachers as well. So they feel more confident in how to monitor quality provision, so they know what to look for. Yeah, so that aspect of it. So part of early intervention really is around our workforce and ensuring that our workforce are equipped with the skills and knowledge that they need to support our children. Louise has mentioned the sort of increase of SEND and the various types of SEND as well. And actually, so our duty and our role is to how do ensuring that all our teachers, teaching assistants, leaders, etc., are able to support a wider range of need, which is beyond then just what you'd expect for all children. So we do quite a lot of work around that. So the OT that I mentioned carries out sensory learning walks. We've actually done the same with speech and language therapy as well. We've broadened our CPD offer, which reaches all layers of school staff. And what we've actually done, working with our health colleagues, we've created a one-stop shop. So schools just have to go to one place to see the training that's available across the whole partnership, rather than having to go on the speech and language website and then someone else's website and then our website. So we put it all into one offer for schools, which has been working really well. We have a therapeutic thinking, which I'm sure you've heard about before. So that's continuing to be rolled out and really well attended training. And we had a recent conference on EBSA. So again, bringing schools and partners together on how we can support children who are not attending school. We are also working on an early identification toolkit, so schools are more confident in how to assess need and actually and make the accurate decision about what the primary need might be for a child as well. We offer schools send-in inclusion visits. Adam and I do that, so for primary and for secondary schools, where we will go in and carry out sort of an audit of need and we look at provision and then offer recommendations. And with those recommendations, we also put a sort of an offer of support around that, tapping into our outreach providers. We have a consultation line that school leaders, SENCOs and school leaders can use. It's really well accessed actually. We have an experienced SENCO who's worked in Ealing running that line. And then we also have a SEND Family Partnership Award, which started 3 years ago. and we're now looking to see if we can create an early years version of that partnership board as well. So supporting schools to work to sort of really understand their parents' views, and then putting in changes and recommendations as part of sort of like an audit sort of process. So you do the audit and evaluation, you see what parents want, you put something in place, and then you review it again. And that's been really successful. We've got around 26 now case studies specifically for supporting families with children with special needs, which is going really well. In terms of our performance, children with SEND in Ealing, have really good outcomes. We are, always in line or above national. So we're really, really proud of that. As always, though, it is about reducing the gap, between all. So SEND, like for like, we do really well compared to national. And actually, what we really want to be making sure is that every child is getting sort of thriving for what's right for them. And that's about, as we talked about, the early identification, but also stronger assessment and really supporting schools to really assess need. Because if you're supporting a child that you've perhaps never had that experience before, then actually we need to ensure that that teacher is able to assess accurately and then put those next steps in. We also have an outreach offer to schools. It's a really rich outreach offer, and that's a mix of local authority sort of officers, if you like, the OT that I mentioned, and then our specialist schools. They carry out the outreach for us, and that outreach is a mixture really of one-to-one support, workforce development and training, and sort of whole school approaches to neurodiversity. So it's sort of different layers that we cover, and again working with teaching assistants hand over hand, really modelling the strategies. There's one thing saying do this, but actually showing teaching assistants how to do it really. And in terms of our evaluation, really, really strong responses from schools, and that it has an impact on their sort of professional development as well as making a difference for the child. And the last bit really, I think, for me to share is we carried out a SENCO survey in 2022, and again in 2024. We'll do it again, I think 2026. But you can see there that the increase in terms of SENCOs who are now part of the senior leadership team has gone up by 22%. So 82% of our SENCOs are part of SLT now, which is fantastic. 89% feel that head teachers better understand their role. 86% feel that teachers better understand their role, which is an increase of 44%. So you can see, what the picture looked like before we did this work. And 65 are involved in the monitoring of teaching and learning alongside their colleagues, which is an increase of 34%. And I could say if we did that again now, the numbers would have definitely increased. Yeah, absolutely. I hope that gives you enough of a flavour of some of the work that we're doing, and continuing to build on. I don't know if anyone's got any questions or.
Thank you, Madhu. That was really,
Pleasure.
really helpful. I don't know if anybody has a question about it. Anybody online? While you're thinking about it, obviously I have one. Apologies. First of all, I think it's great stuff because I think it's really important to try and intervene early. One of the things I mentioned on a previous call was something I'd read in The Economist magazine about Portsmouth and what they were doing, which sounds a bit like some of the things you're sort of doing, but I don't know if you've had a chance to think about or even aware of that article, but basically my understanding was they were trying to get the teacher, the SENCO, the parents intervene so really quite early when there was a behavioural issue and try to deal with it at a very localized level in the classroom before they did a kind of assessment, a kind of a health assessment. But because it was better for the kid because he gets sort the problem out, and secondly, obviously for the it saves an enormous amount of money for the authority. And I don't know if you've got any.
So therapeutic thinking is one of our sort of key tools that we use to encourage a therapeutic relational approach in our schools. And as part of that model, there's something called roots and shoots, and that's exactly that. It's a tool where okay, we're a little bit worried about this child. Actually, let's unpick what's going on using this toolkit. And it gives a holistic view of that child. Have we considered what's going? Is it something happening around siblings? Is something happening at home? Has there been a bereavement? Is the child really struggling in particular subject areas? So that tool is kind of the guide, really. And we have Dee, who is our therapeutic thinking lead, and she will go in and support schools through that process. We also have an EHAP, which is another sort of tool, really, which helps in terms of early help. So maybe not just the sort of the learning need, etc. It could be if there's other things going on for the family. So yeah, so and again with this, there's lots of prompts and questions and guidance in this around what might be needed. Alongside we've got OT handbooks as well, which again lots of checklists and prompts for teachers to be using.
Right. I mean, I think they is exactly that. They had a therapeutic neurodiversity checklist that they used in Portsmouth. And just on that, just very briefly, do you look at other authorities and what people are doing around the country? Because it's a complex area, as you said. I don't know how you compare.
So there's a few sort of regional spaces. So NACEN run a regional network. We have in the early year space, there's a Best Start for Life network. So we do get into different local authorities. There's also, we are part of Autism Education Trust, and obviously they're national, NACEN are national. So yeah, we do keep ensure that we sort of meet with other colleagues. Also, actually, we do try to meet. I try to meet quite with our close partners as well. So Hounslow, Hillingdon, etc., to have those conversations a bit more regularly as well. So yeah, we do. I mean, more would be great, and then that sort of intimate kind of conversation, because there are quite big forums, if you like. But yeah, we do.
Thank you. I think I've got a question from Shadi, but I think Aretha, you wanted to make a quick comment.
Yeah, just to add to what Maddie was saying, some of the things that one of the partners that we've got is we're part of an incubator project for Quorum, which is a national charity, and they do a lot of work on disproportionality, but they also do a lot of work on SEND and early intervention, and that gives us access to a network nationally of best practice and what that looks like, and some conferences and some training, and they're doing some direct work with our service around advocacy for young people, but also around disproportionality in relation to exclusions and suspensions. So we've got these local networks, but we've also reached out nationally. We also work with the local government association advisors around, what looks good nationally and what's having most impact in terms of the partnership.
And also, actually, we share what we're doing here in those spaces as well, which is great. So part of the RISE advisors, so a new initiative from the DFE, they've come to us to ask us about our ELT model and how we work and our clusters and things that we're running. So we're also sharing outwards as well as sort of learning from others, which is something for us to be really proud of, I think.
Yeah, that's great. Brilliant. Shadi, did you have a question?
Perhaps less of a question and more of just an observation. I think I just wanted to make it clear that I'm aware of the sort of therapeutic thinking and the learning walk in terms of the OT that you've got that you sourced and all the other elements in terms of training teachers and senior leaders and Senkos and so forth. Just a bit of feedback insofar as I'm sure you've had it already, as you've said in the paper, but it's all very positive, and I'm sort of seeing positive elements of it constantly coming through, either in communications directly through the local authority, directly through schools, who are then sharing that information with parents, so that they can also get involved. And obviously from the governor's side, I'm aware that teachers are also feeling somewhat empowered by having specialists come into the school, review sort of what provisions they've got and how they can better reach children with SEND, but also just the whole cohort of individuals that may or may not be identified just yet, but sort of on the brink and so forth. So just to say that I think it's very positive.
Thank you very much.
You're welcome. The only other thing, I guess, is are you facing any challenges? Obviously, I know that there are there's an increase in children with diagnosed with SEND increase, obviously in EHCPs and so forth, and obviously just limited financial resources. And it seems that you're doing a lot, but I guess are there any sort of challenges that you're facing that you feel? I don't know.
Yeah, no, absolutely. Yes, no, thank you. Yeah, so in terms of the real challenge in terms of schools, they are struggling with staffing. And so to carry out some of the interventions and work that they would like to, they really struggle, because if gone are the days of having a very healthy supply budget. So if a teacher is absent, then the TA might be supporting that class, which means that they're then not doing the intervention that they had planned. So really really trying to unpick that and work through that with schools is something that we're trying to do. But also alongside that, we've got one of our sort of new projects, I suppose, in a way, is mainstream schools are working towards ensuring that all their children get the right provision, and as part of that, many have started to develop specialist classes. You may have heard in the news and other things, there was something in the BBC actually just this week, and so one of our challenges in that space is, this is new for everybody. It's new nationally, but where schools are thinking about creating these sort of specialist classes or sort of mini hubs, if you like, in their schools to support targeted groups of children. And so for us, one of the challenges is, how do we ensure the quality of those spaces? So we've set up a network, and we are creating a framework of key principles and a sort of training offer and program. But alongside that, it needs to come with what does the curriculum look like for these children? How do we assess the needs when you've got children with a range of different needs? How am I accurately assessing what every individual child needs and ensuring that the curriculum is personalised enough for them to thrive? So that's a big piece of work that we're focusing on this year, to really upskill again the workforce and ensuring that those sort of spaces are really enabling children to have the best possible experience in our schools. So and it's ongoing actually in terms of so a school, you may have experience of supporting children, with autism, and you may have experience of supporting various need. But if you've got a child that's come in and it's like, oh, okay, I've never, this is new for me. We need to be able to react quite quickly to support that school so they can put provisions in place. So it's about being responsive, and that's can be a challenge within the kind of the capacity that we have, and it's how do we respond quickly enough to the school so that they have so that they feel confident in helping that child from the sort of first day. That makes sense. So all of those elements really for us are things that we're working on, but we are really lucky with the outreach team and the officers that we have, because everybody's very they're so skilled. There's such a vast sort of richness of experience that actually there is somebody within our team that can support, and it's sort of, and that's something that's fantastic. And if an outreach provider is in one particular setting and they think, do you know what, I'm not quite the right person to support you with this, they will then signpost to who the right person might be. So that relationship is there now, where people are sort of cross
multidisciplinary team.
Yeah.
Very, very powerful.
Yeah.
Thank you very much
Thank
for
you.
that, Madhu. I think we probably should move on, and just very briefly on co-production, and then we can move on to I think it's Adam, isn't it, who's going to talk to the last item.
Last two items. So co-production is something that's enshrined in the Code of Practice that we've referred to earlier. There is a responsibility on the local authority to co-produce a lot of its guidance, its policy, but also some of the strategic work that we undertake. And because it underpins so much of our work, one of the things that we've recognised following the peer review that was conducted in February 2025 and the Ofsted inspection spoken about and mentioned previously, and some of our own internal evaluations, we know that co-production is not where it should be in terms of our approach to it or in terms of the impact of it. So what we decided to do was stand up a co-production project, which involves parent carers, involves our youth social network, which is a group of young people with SEND that run their own network. It's almost like a council where they can feed into some statutory work, but also have some social events. And so they're our key partners. And what we wanted to do was design a co-production charter that was Ealing based, but really driven by the needs of our young people. So we started this project over the summer, and what I'm most proud about this project, I think, is the fact that we started with young people. So we asked them what co-production was, we asked them how they felt about it, we asked them what they wanted to see as at the end result, and that will then be. And what we've done with that work is we've layered on top of that work. So we've consulted with other people and parents and carers, which we held an event at the start of November. We will consult with schools. We will co-produce and layer on and kind of develop the initial principles that young people have identified in their co-production workshops. They've also produced some wonderful videos that will be on our local offer, so I'm happy to share those links, and you can see them talk about their experiences of co-production and talk about how they value it and what they would like it to look like in the future. We've done a lot of research and evidence base for this piece of work, so it is steeped in a bit of research and it is steeped in a bit of best practice nationally, going back to your earlier point. And so we will be aiming to get the charter for SEND finished by February half term. And then the intention is to share that work with Children's Services, so then Children's Services itself has a charter for co-production. So we will start the work and hopefully it will then roll out across all of Children's Services.
Thank you, Aretha. Any questions about co-production? I think if we can, then perhaps Adam can introduce the final topic, which I think is an important point about children missing education. Adam.
Yeah, hello. I'm Adam Brazier. I'm the Head of Access and Inclusion. One of the areas under my service is attendance, and within that sits children missing education and children missing out on education. So I think it's really important to make sure that firstly we understand what the difference is between the two, because when the DfE created the names, they very unhelpfully made them very similar. So children missing education are children who are not in any form of education, whether that be school, education other than at school, or elective home education. They are in effect out of the system entirely. And children missing out on education are children who are in school but not receiving a full-time education. So there's the difference between the two. Our children missing education work is, as with most local authorities, generally fairly straightforward. The peak year groups for children missing education referrals are reception and year 7, usually down to lack of application for schools, either at reception or year 7, and can generally be found pretty quickly. And if they are located, then what we do is we try to support them to make an application. And by and large, parents do that. Occasionally we have to enforce the situation through law. But for example, last academic year, we only enforced 6 what are called school attendance orders, which enforced a parent to attend a school that we allocated to them, usually with discussion, but there were only 6. And as you can see, there were 760 referrals last year. That's a very tiny proportion. The referrals did go up last year. It does fluctuate, I'm told, year on year, but we did have more children moving out of the country last year, and they would become children missing education, because until you know where that young person is, and that's been verified by the new setting, they are children missing education. So if a young person moved from Ealing to Derby, for example, they would be on our caseload until we know that they had a school place allocated. That's fairly simple to get hold of someone in Derby and verify that. If they move abroad, it is much harder. And actually last year we did end up with 109 referrals that we had to close because we couldn't find them. We exhausted all things, and we have links with border control. We can speak to HMRC, and once we've done that, we do actually just close a referral. They sit dormant, so that if they do come back into the system, we'll then pick them up. So CME is a relatively simple, straightforward process. Children missing out on education is more complicated for us, because they are children who are at school but are not receiving what is now 32.5 hours per week, which is their entitlement. That could be for a number of reasons. Sometimes they can be at an alternative provision. So they are maybe attending a college on a work placement type vocational course. Sometimes it is a part-time table. Sometimes it is a combination. There are all sorts of different possibilities. And the number of cases for children missing out on education has also gone up again. But that is actually due to an awful lot of work that our Children Missing Education Officer, Claire Hoop, has done in making the referral process easier for schools to notify us. Schools do have a duty to tell us for any children on missing education. And over the last 2 years, we have made that process simpler for them. So we are now getting a better reflection of the number of children who are not receiving a full-time education. If you look in the pack, our peak years for children missing out on education, so therefore not receiving a full-time education, are reception and then key stage 4, so years 10 and 11. Reception is very often a settling in. So the school, alongside the parent, because the parent has to agree, it cannot be done without parental agreement, to a reduced timetable as a settling in process for a child into reception age. And most of those cases are around settling in. There are some where it falls under what the category is temporary reasonable adjustment, where a school is saying we cannot meet the needs of this young person full time. It's not appropriate for this young person to be in full time. It's not right for them, and we are doing a reasonable adjustment in making it less hours for a period of time. When you go through the age groups and as they get older, you tend to find that part-time tables are used more for emotional based school absence and or in order to help support a young person's behaviour. Now, the DfE has always been clear that part-time tables shouldn't be used for that. However, schools do it and we understand why, and it is often in the best interest of the child. What we have to look there is the length of time of the part-time timetable. And the DfE has recently published new guidance on what they are calling non-school alternative provision, and they are going to reinforce in law that a part-time table should last a maximum of 12 weeks. And we do have some young people who have been on a part-time table for 112 weeks. So there is work to do on supporting schools on bringing those young people back in to the mainstream and giving them a full-time education. The new guidance isn't law yet, but it will be, in the words of the DfE, as soon as parliamentary time allows. And it will also change the oversight of young people on alternative provision. Currently, schools can do that and must do their own quality assurance around an alternative placement. Whenever this becomes law, the local authority has the duty to ensure that all alternative provision is quality assured, and schools will not be able to use their own placement unless we as a local authority have deemed it to be appropriate. So that's we're trying to currently work out how we're going to manage that process. Madhu's already mentioned around EBSA, the emotional based school absence. That's an ever-growing reason for children being on part-time tables or being absent. There was a really good event last month where schools came together with local authority officers and voluntary sector, looking at ways to support young people who are currently experiencing that. But that is a growing a proportion of the young people who are not attending full-time school. It sits within our attendance team. It's all about support. We are a very supportive team. Any use of the long arm of the law is an absolute last resort. We work very closely with social care colleagues. We have a complex case panel where we discuss young people who are on long-term part-time tables, trying to see what we can do to all work around the child to try to get them back into a full-time provision so that they can achieve the best that they can achieve.
Thank you very much, Adam. It's quite worrying when you can't find 100 kids. This is the CME.
They've nearly all gone abroad.
They've all gone, and we know that. I mean,
The Border Force have confirmed that they've gone,
okay.
but we don't get a response from the school in Bolivia telling us they've started, for example.
No, I understand. I was just worried that they were lost in the
No,
UK.
no, they are.
But,
I couldn't tell you that all 100 were,
Yeah.
but I know from talking to Claire a lot that is where our that's where we close it, make it dormant.
Fine, thank you. Any questions from anyone? Yes, Councillor Dear.
For me, it's difficult to understand, to be honest, how children can be missing their education, even year 5 and 6, as Adam mentioned. Sorry? It's tragic, yeah. So parents or guardian, you must have a responsibility to inform the local authority or the school if they're taking their children away. It's unbelievable, really. Children are just, I was thinking 0 to 19 years old, I can understand. They can make their own formed decisions, whether they want to go to education or not. But year 5 and year 6, they're very young. It's difficult for me to understand how can they just, and they got special needs education. Yeah.
So 626 were closed during the academic year 24-25, which means that a child becomes missing when they leave, but you don't have a notification of a new school. So if somebody did move from Ealing to Derby, as using my example, if there was a delay in a school being allocated in Derby for whatever reason, there may not be a place. And these aren't necessarily young people with special educational needs or disabilities. They are just young people. And it may be that there may just be a delay in the process. They may have had to go through the fair access panel. The parent may not have yet made the application. So they will be missing their education once they have been missing school from the Ealing school for 20 days, and the school knows they are no longer living at the address they were living at. So it doesn't mean they are missing for any length of time. It just means for that period of time they are missing. Yes, there are some worrying cases where families may leave unexpectedly, and we don't know about that as a society, as a local authority. But the vast majority are just time lags between leaving one school and being starting at the next one.
Thanks, that's a relief. Councillor Kwanzaa.
Thank you. Considering the reduced timetable, how can we ensure, got me thinking that we can, it can be reduced, you know, so it's not like long term or misuse. That's what I'd like to, you know, ask you, Adam. Thank you.
So the new guidance will help us in that. It will reinforce our ability to challenge schools on this. The current guidance is very woolly. You know, we can say it should be this, and schools will say, but it isn't. This is what we're doing. The new guidance will give it. It says 12 weeks, unless there's a medical reason. So, you know, you've got a young person recovering from a serious illness or it's not appropriate, that's absolutely fine. If they're in a full-time provision somewhere else, so they may be at an alternative provision for, say, year 11, somewhere else out, that's fine if it's full-time, but the homeschool has to maintain the responsibility for their young person. But the new guidance, whenever it becomes law, will give us far more authority to go in and say this is not okay and this needs to happen.
Yeah, so does that mean that there will be visits, or parents
so schools have to notify us? We have 2.5 people working on that system in this process. We are now we've got a piece of software that flags when things go beyond the 6 weeks and go beyond the 12 weeks.
Right.
That software also notifies schools that we know, and then after the 12 weeks we will be able to pick up a phone and go, hello school A, we are aware of your child who's not got a full-time offer at the moment in year 6. What's the update?
Okay.
And we also, Madhu mentioned inclusion visits. I've got 2 coming up to secondary schools at the beginning of December, and on our agenda is children missing out on education, because we are aware of a relatively high number of children.
Yes, thank you, Adam.
Thanks very much, Adam. I realise we have one more item, which I think we probably should take now, which I think is send transport. Who's introducing that? Is that you? You're busy tonight.
It's going to be super quick as well. So with send transport, what I've outlined in the paper is the statutory responsibilities as laid out in our policies. So we have 3 elements to send transport. One is early years, which is a discretionary send transport allowance. So where we find children really do need that additional support for transport to get to a nursery or to get to a setting, then we can, at our discretion, assign transport or allocate transport, and there's mechanisms to do that. We then have the statutory school age transport, which is for age ranges 5 to 16, which is steeped in law, and there's loads of criteria about against it. So the nature and severity of the child's mobility needs or the special educational needs, making it unreasonable for them to either walk to a provision or to make it there safely or to travel on public transport. So we take into account things like mobility, but we also take into account diagnosis of autism, for example, because actually that can impact how a child moves from A to B, whether it's on public transport or being able to walk a certain distance unaccompanied by an adult to get to education. And then we have our post-16 discretionary policy, which was recently reviewed. I think it was reviewed almost a year ago, actually. And that, again, is discretionary. And we've reviewed our process, allowing for higher elements of what we call independent travel training, but also higher elements of personal budgets and higher elements of shared transport to ensure that we've got the right provision. That also maps onto the earlier comment I made around our further education colleges and the work that we have done to get children there. That's allowed for some of the shared transport and travel assistance to take place. Our personal budget, we will allow some personal budgets to go to either any of those 3 criteria. And that allows for more flexibility for the family. So, for example, if you are in a mainstream secondary school, but you have to get on a bus or in a cab with 3 other children from 3 different year groups, actually that prevents you from accessing things like after school clubs. It might prevent you from accessing GCSE revision or coursework elements that often take place after school because you've got to leave on the dot. So giving parents the personal budget allows for that flexibility and those changes to happen as and when the children's timetables change. And then we have our shared element of transport and a charging policy that was in our post-16 discretionary policy. The main headlines really are I was asked to provide some statistics and breakdowns over the last 2 years of the take up of each of those elements. And then you will see a table indicating the take up of travel training, which is really important because it prepares our children for adulthood. They're not always going to be able to get a cab or have someone accompany them from one place to another. For a majority of children, actually, they might need to learn how to negotiate travel and negotiate change. For example, if there's a strike or something and they need to change direction or the bus is late, like those things can heighten anxiety quite rapidly for some children. So it's learning how to cope with those elements, not just crossing the road or, having to pay for top up your Oyster card. It's a bit more than that.
Thank you. Very good summary. Any questions or comments? I think, Sade, you've got your hand up.
Yes, just a very quick question, Chair. I noticed that the eligibility for 5 to 16-year-olds, council will consider pupils from a low-income family, and the definition or part of the definition is a child receiving free school meals. I know from a school perspective, sometimes it's difficult to identify children who may fall under that category, partly because of the Mayor's Free School Meal programme. Is that something that you've recognised in the borough, or has there been a sort of significant drop or anything, or is that just nothing that's sort of been picked up or noticeable?
you just repeat the point of the question? I've got the bits around the edges, but not necessarily the point that you wanted me to address.
So, for example, I don't know what the percentage is of whether the borough will assist low-income family on the metrics of them being the definition of them being a low-income family based on free school meals. I'm just saying that from the statistics, I know there's a tax credit side of things. It says, I think it said, or looking at sort of the working tax credit element. But I just wondered if it was difficult to identify children that might fall under free school meals just because of the free school meal programme that the mayor had sort of rolled out across London in the last few years.
Can you say that? Yeah, so there's different benchmarks because we've got the working tax credit and then we've got the free school meals element. And I think the issue with the free school meals element is sometimes it is about the claiming of that. And so some children do miss out because actually the families don't claim the free school meals that they're entitled to. When we've put in our charging policy, we did put in more around actually the definition of working families because we were looking at 3 tiers of charging for the discretionary policy above 16. But within the 5 to 16 element, my understanding is that some of this is enshrined in the legislation in terms of what we can and can't do, and certainly what we can and can't consider in terms of transport arrangements and criteria.
Yeah, no, I totally understand that. I just wondered if there had been a sort of difference in individuals that had sort of you'd identified based on free school meals, and obviously it might be slightly difficult to identify that now in the last few years.
Yeah, it would be because the travel assistance is done by application by parent as well. So you've got 2 application processes that you have to combine in order to answer your question, I think. We'd have to do it retrospectively following the application and then look at who was eligible for what and maybe the socioeconomics around that. Makes sense.
If I can just add, I think we do have fairly good data on the free school meals because we've done a lot of work for the HAF programme. Because obviously eligibility for the HAF programme is obviously based on free school meals as well. So obviously we didn't want people missing out on that. So I think we've done a lot of work. I'm sure we can get numbers possibly from Tamara or Aretha around that for the committee. But I don't think it's a particular concern that we've got too many missing out because we haven't got the data on it.
Thank you.
Thank you, Councillor Blacker. Anything else on this item? Can I say it was despite the fact that it's complex stuff, it was actually very interesting. I do thank the officers for making the time to come and speak to us and all the committee members. It's a really important topic, so thank you so much.
Also say to Madhu, I think you people are doing quite a lot. I never imagined so much is going on with this group of children or peoples. Really marvelous. Your presentation was excellent and we learned quite a lot. I learned quite a lot tonight. Thank you very much.
Recommendations. Wow, it's hard for me to distill that. I think from this paper, you mean?
Yes, this report.
Okay, the committee members going to have to remind me some of the things we had. I mean, can the officers recall some of the things that we discussed that we wanted to pick up on?
Yeah, so there was at the start of the meeting a crossover between early help and SEND and just bottoming some of that out.
That's right.
In terms of preparation for adulthood.
Mm-hmm.
There was a comparable table of Ofsted outcomes, looking at similar areas, looking at London, and I've noted looking at areas with ICBs that cover a broad number of areas in relation to the areas that our ICB covers. So we've got some like-for-like comparison. Post Ofsted inspection plan copy to come to this group in February, and by then we may have some progress that we can update as well. So we would have started the work, so we might be able to give a short, sharp summary of impact. Some data on disadvantaged and marginalised groups from our Citizens Tribunal, potentially looking at socio-economic differences and class alongside race, and trying to map that over in some sort of Venn kind of diagram and get to the bottom of it. And then the free school meals and HAF numbers to provide an indication of the take-up of free school meals for the 5 to 16 age range.
Perhaps I can add, it'd be useful to get Madhu's report circulated to the team. That would be good. And then there was, I think you may have covered it in your list, I can't remember, but they're just going through this report and just tidying up some of the numbers and definitional things just so that it's a good reference for the committee members going forward. Okay, thank you very much. I think that brings the meeting to a conclusion. Thanks again, everyone. Bye.
Thank you.
Thank you.